Welcome everyone this evening. As you know, my name is not Dr. Kerr, and I've been tasked tonight to run this meeting. Thank you for coming this evening. I see a couple of faces, young faces over there. Would you guys mind introducing yourselves? Yeah, so my name is Nick. I'm one of the people from fellows and share with
My name is Ida. I'm working in direct things as well.
and Chicago is home for both of you?
Yes,
Oh, great.
homegrown salads. Yes, we'll
Well,
talk about this a little bit during the director's meeting.
Next is privilege of the floor. Do we have any or any communication, any letters? And we'll move on to the item 3, which is approval of the minutes from September.
Oh, I'm sorry, who was it? Okay, thank you.
Dr. Khan seconded that. So moved. And the new business. Agreements to sell.
So you'll see in your packet this evening, we do have 4 pages of agreements to settle. I have invited Miss Natalie to join us this evening. We'll talk some more about public water supplies and our ideas for fines and things moving into 2025 in a few minutes here. But to start with, in these agreements to settle, there's always the public water supply violations. You'll see that there's a number of violations. It's the same general violations that we're citing time and again for failing to submit necessary samples, sample results, and necessary monthly monitoring operation records. There's one new one in here on page 2. It's the third violation titled down. It's a violation for the respondent failed to maintain a free chlorine residual at representative points in the water distribution system. That fine is issued when we visit a facility and they don't have chlorine in the water when they're supposed to have constant chlorine in the water. So that's one that we haven't seen come up frequently in these agreements to settle, but it is something that happened for this facility in this last, recent collection of agreements to settle.
President, see Gary Tanner got 6 fines.
Mm-hmm.
What is the cost of his testing?
So this isn't even for testing. Those fines are for failing to submit the monthly operation record. So that's the piece of paper where every day you write down what your chlorine residual is and that you have checked your system, and then you send us that piece of paper before the 10th of the following month. So it's not even a sample, it's not a cost. It's the cost of having a water operator on site doing the things they need to be doing. But there's not actually a cost. That's submitting a piece of paper on time.
But it's like a first time.
So for the Dollar Generals in general, no. For each individual one, I'm not sure.
So for each individual, what we do is we give them one what we call get out of jail free, because Jerry Tanner is their overall operations manager. He is not in these stores every day. They've got an on-site manager. So we have, essentially in a 12-month period, we allow them one screw up. If you get your report late to us or don't get it to us at all, we send you a letter to remind you that you need to do this. It's when you screw up more than once in a 12-month period that we're sending you a fine. So all of these stores have at least more than once since January 1 not sent their letters to us with their monthly operations.
When they ultimately pay the fine, do they also ultimately submit the report?
Very rarely.
So one, well, I'm not saying you do, it's really never also comes to credit card.
Correct.
But the next one is only the second condition. That's when it has to be right.
They submitted at least, yes.
Right?
No, but can I just say that there's operations other than as Jessica just said, you know, when we catch them, there's a flame of water. Correct.
So if we actually catch them and not put them in water, if they submitted records that they have,
That's false.
Yeah, exactly. We're always a month behind. So when we're there checking for chlorine, you don't have the report yet. Exactly. It was there this morning. I just didn't write it down anywhere yet.
So since July, records have been submitted.
I can tell you for certain. So believe it or not, we do this old school and new school just for this reason. So yes, we have gotten all of theirs since July. I don't know that for sure, but quite possibly. 0.2 is the lower limit of what they're allowed to report.
so they could just be falsified records.
Yeah.
Is it right?
Unless we're there.
Yeah. We have on occasion walked in, saw the sheet on the wall where they do the record, and you know, there's a number written down, and we're there the same day and get nothing in the water. Gently but firmly call them on it.
It's also hard to tell though, because I mean, truthfully, there's a variety of things that can go wrong with a water system. So it's hard for us to say with absolute certainty that what they saw at 8 a.m. is not accurate based on what we see at 3 p.m. There's a big chunk of time where who knows what could have gone wrong. 8 a.m. could have been accurate. And then we get there, yeah.
That was Natalie's point earlier too, of that, you know, the graces of a first time violation and the responsiveness on behalf of the business owner, and they could tell you stories after too. And just recently, there's one where it's, you know, somebody comes in and they're like, I'm so sorry that we did not realize like the extent of this and what this is, and we're going to make this right and educate us on this. Natalie's and Jessica's staff sat down. I saw multiple times throughout the day different staff members in there working with them. That's a very different scenario as opposed to the repeat offender that clearly this is not Jessica's staff and Natalie's lawyer team do a really nice job in kind of investigating that and getting a sense of that from these businesses. Because really the ultimate goal is to be supportive and to provide technical assistance. We want businesses to thrive in the community, and so they're here for support. You can tell pretty quickly the business owners who are a bit more adversarial and you want to see how much to do with that and do right on behalf of the health of people in the county.
Can I ask you a question here? These are Dollar Generals.
Why are we bothering?
So what's
I
their,
can tell you.
What's their,
So Dollar General stores are licensed under the New York State Agriculture and Markets permits. There is a memorandum of understanding between New York State Department of Health and New York State Ag and Markets, which states the New York State Department of Health will regulate all ag and markets water supplies as public water supplies. We don't issue a permit for that. It's the same thing. You remember we talked about a year or so ago about a winery that's the same deal. They're an ag and markets facility, so we don't issue a permit for them. We don't issue any sort of you're allowed to do this.
A winery, they usually have a little tasting area. They may serve water to rinse your mouth out.
Because Dollar Generals have a water fountain.
They have a public restroom with a water fountain.
Yeah.
Okay.
And it's not even a water fountain. If they have a public restroom, ag and markets consider them.
Okay, that's fine.
Yeah. Sorry, I jumped ahead of your question. Sorry.
Fine, that's okay.
The scenario that we're always getting is that, you know, somebody could go in and fill up the baby's water bottle, you know, water bottle or something.
Yeah.
But yes, it makes it a little hard because we don't really have any food.
We don't have any teeth to push back other than issuing this fine. It's not like a restaurant where we can, you know, have the fallback of revoking a permit or anything because we don't actually issue a permit for them. Yeah.
So you don't see revenue from the permit right now.
Correct.
So yeah.
stores at the market? Or is it just Dollar General?
The
Dollar
retail,
Tree.
the retail facilities that have a like 50% or more profit from products other than like prepared food stuff. So like Crosby's, the gas station, they're egg and markets. They're not under us because they've got beer and packaged food stuff and all of the other things that they sell. So they're not ours. I mean, there's a few Crosby's that are public water supplies because they're on wells, but again, they're not issued a permit under us because they're not considered, their primary function is not considered a, prepared there, eat there food service
What's the
establishment.
ag markets test their programs?
No.
I can't tell you what egg and
I
market staff does.
think this becomes the absurd.
Right, yes.
Yeah, Ag and Markets MOU is with New York State Health Department because Ag and Markets, quote unquote, does not have water experts that are familiar enough with treatment systems and wells to improve them. So they rely on us.
Our immune systems are pretty strong to tackle.
Yeah.
We're probably seeing a lot more things happening, and it's not.
I mean, we talk about the ones that come up with these agreements to settle, but we don't want to paint all water supplies because some of them are great. Some of them do all the right things and they care deeply about what they're doing. So, I just don't want to. I don't want to make it seem like there's no good water supplies in the stuff.
Yeah, 230 water
Yeah.
supplies that are required to report every month, and you can see the few handfuls that we have.
And they're typically frequent flyers, the ones that you're scanning. So those are the top part of with the water supplies, and then there are also the tobacco enforcement programs. So just to help you guys segue, it was previously called a TUPA program. Now the state would like us to start adopting the tobacco enforcement program title for those things. So that's what I'll be calling it moving forward. So there were a number of violations. The top 3 on the list there were first violations for these specific facilities. The lower 2 were second violations, but they were second violations in the history of the facility. So we did increase the fine, but the number of points expires after 3 years. So you have to, for us to move a facility to the next step of having sold twice because they have 4 points and move towards a license suspension, they have to sell twice within that 3-year period. And so these facilities have sold twice, but the first time was more than 3 years ago.
And it doesn't matter if the facility changes owners.
Yeah, if it's a new owner, it's a new facility. So anytime an LLC changes their name, they're a new facility. Mm-hmm.
When you say history is a long time. I'll fall back to you. And I guess not that it matters if the points expire after 3 years anyway.
Yeah, I'm trying. I don't know exactly when the TUPA program started. I don't know, Ken, if you happen to know when it all started, but.
So theoretically,
I'm hoping it's not, I know it was probably 15 years, but right now.
just wondering if there ever driver's license drop off the record. Okay.
So I mean, we do keep track of the history from when we've started so that we can, fine them appropriately as those 3-year intervals, expire. But, Any other questions about the agreements to settle?
And then you had some legal issues that you passed around.
Yeah, so there's one fact and finding in your packet, and then I've got 2 other fact and finding outside of your packet. And I apologize, but those hearings were just last week, so Betsy was able to turn around and get them to us quickly. So I wanted to make sure we got them in so we didn't have to wait until January. So the fact and findings that is included in your packet Natalie, do you want to just speak to the case, or do you want me to?
Yeah, I mean, there again, if you look at the violations for this month, this guy is a frequent flyer. Somebody that we consistently have issues with. And we got to the point with him where we didn't offer him the agreement to settle. Because yes, he'd rather just throw $100 fine at us than do what he's supposed to be doing. So instead, we called him in for a hearing, which he does not appear to. So the hearing is held in his absence.
So our staff testified, you know, and were interviewed, and Betsy heard the case and ended up with a recommendation to move forward with the fines. So the hearing was for the three violations. So if, you know, since we are still currently operating at that $100 per violation, the amount for the total fines would have been $300, and then it would be up to you folks to decide if you feel that that is sufficient, or if you agree with the facts and findings altogether.
You say it's a frequent flyer?
Yes.
And there had to be a hearing with their time.
Correct.
We're gonna be talking about a new fine schedule.
Mm-hmm.
This will be the last meeting for this one. Not saying Justin.
Didn't we have somebody like that?
Yeah.
That's right. Not these minutes. The meeting before them.
Up and make changes then.
I didn't know.
Like Rick said, we have the new schedule in front of us. So it doesn't look like, those are the people from that we're going after.
Yeah, the July.
So
meeting.
yeah, I think the one thing you guys wanted to consider last time was the cost of a hearing officer's time, and so for that, for her to hear the hearing and then draw up the facts and findings, it's $200 for that alone.
Can we track that on this? Can we? I would propose that we track that on.
That's a direct thought.
Yeah.
To say nothing of our staff.
Not about that.
Yeah, it's also
Yeah.
legal.
I don't know how legal's time gets if we as a department pay for legal's time. I don't know how that all works with county budgeting. Yeah. So I know that our direct cost that I sign a voucher saying yes, we're paying the Board of Health hearing officer is the $200.
So that's just for hearing officer.
Right.
That's not our attorney staff.
Right.
So I'm looking for a number from the board members.
The minimum we told we did, there's consistency, I guess it wasn't the last meeting, because it's not minutes.
No, it was probably July. I can maybe pull them up.
Just if it was a similar situation, I would think we'd want to be consistent, but it was quite a bit more than 2.
Well, yeah.
It was 5.
You
Because,
say was it Chautauqua?
yeah,
Yeah.
What was that, conviction violation?
yes, that was also that would have been 4 months. Sorry.
Hold on, I'm getting on the old iDrive.
Good. Let's see if I can get on the website.
At a minimum.
That was for 4 violations.
Any numbers, any thoughts? Should we stay at 1,800 or go up to 2,000? Because I'm hearing the discussion around the table. Let's see if we can come up with it.
I think I have from the July minutes, if you don't mind, a fine of $1,000 and a surcharge of $250 paid within 90 days.
That was,
I'm just speaking. Let's see.
That would be okay. So yeah.
Is that the right one? I can keep
Yes.
asking.
So
Okay.
I'm thinking that's, yeah, as far as a,
That would be 250 plus the surgery.
Yes.
250. Oh, 750 plus whatever the surgery.
I'm not good with that math. Sorry.
This is wrong.
What was it?
Correct.
250 times 3.
yeah, plus I think they're at, well, so were you talking, I'm sorry, were you talking about a surcharge of 200 or a surcharge of 250?
Is the surcharge amount fixed?
That's only for the tobacco cases.
I
That
see.
surcharge is fixed by New York State Department of Health for the tobacco cases.
How much is the surcharge?
You sure?
Let's see. Board noted. Let's see. Hearing officer, a fine of 1,000 and a surcharge of 250 paid within 90 days. Let's see.
Yeah, that was,
Total
Yeah.
fixed.
So that would be $1,000.
yeah.
3 times, so 250 plus.
So I would say.
So it's 1,000.
And the surcharge in this case is for the time of the hearing officer inspection. Whereas that case is for a two case, right? That
Nope,
surcharge-
that was a
No,
water
that was
case
a
as
water.
well.
So,
Okay. All right, so there's one off the docket. The next one is also a water case. However, this is the water case. So you'll have an extra little handout in case, people aren't following
Case
along.
number 24-122.
Correct. This is the case that Lacey sort of alluded to earlier. This individual has recently bought a property. They had done the right thing for a number of months, and we had been rolling right along, and things were good. And then we had this hiccup, and they were issued a notice of violation and agreement to settle, and they declined the agreement to settle, and they said, I want to come in and talk about this and come to a hearing and understand, because I don't understand how my property meets this criteria. So they came in for the hearing. Natalie was there. So maybe Natalie, if you would like to speak more to.
Sure. So, we discussed with the hearing officer, her notes there, what his requirements were for his system. He agreed that he did not do what needed to be done. Agreed that he did not know when he came in what exactly needed to be done and why he was qualified as a public water supply. To be fair, this gentleman bought this piece of property out of a receivership, so there was no transition from one owner to the next. So yeah, we sat down and had an hour conversation with him about his water supply and improvements that he needs to make, and or at least an hour. And then from there, he went on to our sewer department and talked to them about what modifications he needs to be making, what he needs to be making on that as well. Just a matter of they got missed on the water sewer survey process, so we didn't do an inspection before we purchased the property. We did it after, and just really needed some communication to understand what his requirements were. And since then, he has emailed me probably half a dozen times with questions and working back and forth and getting things up for him. So at that time, as part of the hearing, because he did make the effort to come in, admitted guilt, and asked for help, I suggest that we help find advance for him. Because if he kept his nose clean for a year, doing what he was supposed to do, then he wouldn't be fined. If he didn't, then he would be fined whatever this fine was, plus whatever he screwed up the next time. We are more than happy to work with people that actually want help and want people to be right.
But he didn't think he was a public water source.
He did not think he was a public water source because his attorney and his told him that it was the number of connections per well that made the difference, and it was not. It was the number of connections on the contiguous piece of property. Yeah, yeah.
I kind of,
Absolutely.
thousands of people.
Well, that,
he was steered wrong. I mean,
Yeah.
that's what it comes down to. You were telling him one thing, and the realtor and his attorney were telling you something else. No,
Actually, you more.
you use a lot of water for a lot of people.
Yeah.
Yeah.
Basically, there's no good
That's what I would recommend. Yes.
questions on the recommendation. I don't know. I'm sure it's just, it's still nice to clean.
Yeah.
So, and I'm sorry to interrupt, but we have sort of used that case as a learning experience for something, for an idea we have about how to do things better in the future, which I will talk about in the next segment, when we talk about fines and future plans for 2025. Essentially, the idea would be, rather than even having them come in for the hearing, offer the opportunity for them to just come in for a meeting with our health department staff and leave the hearing officer out of it and talk to them and allow them to have the option on an agreement to settle that would be to come in for a hearing and hold a fine in abeyance. It would not be something that we would offer to everybody all the time, because if you've been a water operator for 15 years and you're continuously doing the wrong thing, you don't get that option. But if you're a new operator, somebody who's, first offense, then we'd love to get you going on the right track rather than wasting anybody's time and, potential health risks.
If there's no flyer from the start, lawyer, realtor, I mean, that's
Yeah.
an area that needs cleaning up, because
Absolutely.
let us assume this guy is, as you say, a reasonable guy. This is crazy. I mean, they've been in this business long enough to know, or should have access to information to get this hearing properly. If not, then that's some more work we have.
And it's very common to see that. We've seen it, 3 times since August.
Well, and these particular folks were out of PA too. Isn't
Yes.
the lawyers and the realtors are out of PA, which, not that it's a
But
good
it happens
excuse,
here, too.
but
and it's not just water, we do see it in other realms of environmental work around that.
So when somebody comes in and buys a business, should we?
Very good point.
So-
We actually talked about that.
yeah, we do get people who will occasionally call our office and say, hey, I'm looking at this property, I'm looking at this business, can you give me previous inspection records? Folks can issue a FOIL, and we can share pretty much everything with them. It's happened for a few businesses, a few of the larger businesses that have transferred recently. But it's certainly not common for that situation to happen. So the only way that we would get involved is if it has a well and a septic and somebody knows enough to advise that a property transfer inspection needs to happen, because there are restaurants that are on municipal water and septic that will change ownership without letting us know either. And then we don't know until the next time we come in to do an inspection, and we say, well, where's Bob? What happened to Bob? And they're like, oh, Bob sold me a place 4 months ago. And then we have to talk to Jerry now. So, yeah.
So yes, and that's a really great point, and something Jessica and I have talked about, and it's definitely in the purview, and to Dr. Burke's point too, is that we're hoping to integrate what we do better with, some of the boards of realty, with the Chamber of Commerce, and even within the county department, clerk's office. Yeah, that we can, and Jessica's kind of said, like, I keep asking to be involved in these things. You know, we're going to work on formalizing that for that very reason, so that from the get go, Jessica's talked to me about this before. Like, if we could just get people information at the very start and let them know, hey, don't get too far ahead of yourselves because you might lay all this groundwork, literally, and then realize your water system needs some sort of update and you're going to have to bring it all up. So
There was, yes, there have been some high profile businesses that have come about in Chautauqua County where we contacted them because I saw an article in the newspaper that said they were opening tomorrow. And I said, hey, you have this, and this that all need to be issued permits for. I have no idea if you've done them correctly. I have no idea if your rooms, kitchen, pool, whatever are up to code. And not to bash any of the businesses or any of the agencies that had been involved with that previously, but they must have gotten building code permits from their local code offices. They, in all likelihood, got some sort of financial assistance from either a community organization or a small business development organization or some of these other organizations that help out these these startup businesses. And for some reason, nobody ever told them, hey, call the health department, you need a permit to do this. So I'm working on nurturing those relationships with our code enforcement and small business, but it's hard when those folks have a lot of workforce turnover as well.
Also talked about some larger places, large enough, the IDA work as well too. That just seems to be the touch point. I would think since it is county, easier to control, county clerk, IDA, things like that. And it would be great if every attorney in Charlotte County knew this. It's tough. They should try.
Mark's heard from me a lot. We are forging for that exactly. Yeah.
And we have done, there was an event at Celeron Hotel in the fall, and we went and we set up a table. We had staff there, a realtor event, and where they sit through a presentation on whatever new topics they need to be educated on. And we do try to do outreach at those sorts of things, and we had fat little packets of information already for everybody to take. And but I can't make people come. I can't make people take the packet. I certainly can't make them read the packet. So we try all of the things that we can do. If anybody has other, yes, we are open to them.
The chamber's a good idea too.
Yeah.
Well, and it used to happen through the lawyers all the time. When I first started here, we would consistently get FOIL requests from the lawyer's office. Somebody who was looking to buy a piece of property wanted to come look at our records. Kind of interesting that a lot of the same lawyers are still the ones that we're dealing with, but now we never see it. It's rarely see it.
It seems to me that there's got to be a choke point. Like when the deed is signed over, that there's a checklist, and all these things have to be checked off before the deed can pass on. And you should be part of that checklist.
Yep, and this is the same conversation that we have. Actually, we talked about it maybe last time about land. So there are a number of different reasons why it makes sense for us to integrate it into those more formal, those transitional points. And some of this, legal paperwork and necessary paperwork. So, and there's a couple even outside of that, some other executive agencies in terms of some of the tax action properties. There's some avenues there that we've been to work through. So 2025 will be exciting for our partner agencies at the county.
You're raising our expectations.
I know. Yeah, I should have said, okay, 2027. Really.
Go ahead and move with this recommendation.
Yeah.
Okay. Dr. Khan, second. And everyone in favor, please say aye.
Aye.
Any opposed? So moved. On to Mr. Alban.
Yeah, so this one is a tobacco enforcement program hearing. This facility, we did our routine attempted sale where we engage a minor, the minor goes in, attempts a purchase. In this circumstance, the minor was able to purchase a vape product, and that's what it is. The minor was able to purchase a vape product. So it's, a minor purchasing a product that should never have been sold to them. Well, yes, yes. A flavored vape product. Yeah, it shouldn't have been in the store. Well, yeah, it shouldn't have been available for sale in the store to begin with. Yeah. And that's why you'll see the penalty, the fine for this one is significantly higher than other ones that you've seen. We're dealing with general tobacco products.
Isn't today the big smoke?
Yep.
And they're actually targeting menthol.
Yes. Yeah, we've got it. Yeah.
Yeah.
You guys get to do fun work.
Yeah. In some cultures, menthol is associated with murder.
The Center for Black Health and Equity for the last few years. Buffalo.
This name just keeps coming up, and the business name keeps coming up. So I think my question is going to sound redundant. Is that enough amount, or should we add? Is that 1,600? I'm presuming the answer is no. Doesn't involve the legal fee to get.
So yeah, the 1,600. I mean, there's a range that we can issue fines for. So the fines for the tobacco enforcement program are largely laid out by the New York State Department of Health. So that's why that 250 surcharge is always included in those fines. And so for this one, the fine isn't us adding our own sort of in-house surcharge for something like a hearing officer, but that's the fine that's within the range of the New York State guidance.
Yeah, is it 2,000?
2,000 is our maximum. I have to look up for what the flavored vape maximum is. I apologize.
I know it's so much product. There's so many more that
Yeah.
There's probably 30 pieces to it.
Yeah.
No, yeah, we do it here.
Yeah.
Totally. Every single one of the big shops is on.
The problem, and I don't know if I've talked about this before, but the problem that we have as an enforcement agency is that there's currently still the loophole in New York State that allows facilities to sell online. And so there's no way for us to say for certain that something in a store is being sold online or in person.
But it's illegal for them to ship. So you can sell it online, but you
So then you have to go pick
ship.
it up.
So figure that out.
But it doesn't matter, you still
But in this case,
sold it
yeah.
to the kid.
Yeah.
I think it would be relatively easy for us to, because consideration of repeat offender and the act done, at least go up to the max of the county, which is 2,000. That's what I'm thinking. See what the numbers.
So that would be the 2,000 plus that surcharge is that 250 surcharge is automatically included regardless. Yeah.
I'll entertain the motion, right? So,
One more time, who's that?
Marty, Mark. All in favor?
Aye.
Any opposed? So moved.
Before we hop off the subject there too, something to just throw out there. So part of this is, Jessica was alluding to it, we really are kind of pigeonholed with our tobacco enforcement into some very specific regulations. There are discussions happening though, and we'll talk about this again later in the 2023 so that we're being really efficient and streamlined in our approaches to these violations. So where we have some gaps, some other agencies have some advantages.
And recently, in the last couple of weeks, there have been new agreements in a couple of our counties in New York that solidify these arrangements for remote enforcement and waiting happening. Some discussions today with a senior neighborhood people, and it's over who are enthusiastically looking
Well,
to happen
yeah.
really quick.
Well, and there's so many advantages to making that partnership for our staff.
Health department is very much decided that we want to keep this. And law enforcement needs to also
No, that's okay. So I just handed out a little mini packet for everybody. So this is sort of what I wanted to talk about today and take advantage of Natalie's time to talk about the water supplies and the violations and the fines that, you know, what we're thinking as far as the numbers and not just issuing $100 every single time for these violations. So again, we talked a little bit earlier with the one facts and findings case that we would like to, for the new owners and the new operators, offer in an agreement to settle the option for folks to come in and actually talk to us, and we can, you know, work through their questions, give them some examples of how they can set themselves up for success, and actually move forward with that, you know, as an option to get to the heart of what we really want to do, which is create good operators in the county. So our first thought would be to offer that option, and then the similar to what you folks have been just talking about this evening is as far as fines in general and ensuring that we are covering our own internal costs for these different hearings and things, that anytime a notice of violation does go to a hearing, having a sort of standard surcharge that the Board of Health would add to any sort of fee, whatever it is, because like you're saying, you know, regardless of whether it's one violation or 12 violations, it all takes hearing officer time, and there's a minimum of what hearing officer time costs us. So we do have a question out to legal, asking them about if we did institute a surcharge at the county level, how that affects what we are allowed to charge as a maximum fine level. If under state regs a surcharge is still considered a fine, or if we can actually make it a surcharge and make it a different level of monetary compensation. So the next page of the handout is actually the sanitary page that talks about what our enforcement looks like and where we derive the power for that enforcement and what our sort of maximums are, and you know, what some of the further enforcement actions could look like. I mean, if you read through this, and my thought is, if folks are comfortable voting on anything tonight, you're certainly welcome to. But my other thought would be, if you wanted to, you know, take this packet home and review it, and then potentially vote on it at the January meeting. So I've put together the packet that includes that first page of our sanitary code, and then the next page of the packet is what we are thinking for our 2025 water violations, and it would include. So your first column is the nature of the violation, broken down into sort of different categories. And then some of these violations you are going to have, unfortunately, do see multiple violations within the year's time. So we've ramped up the fine for those subsequent violations. The first category would be the operational reports. and those are those sheets of paper that, the column to the right, I've tried to get to that point of how much is this activity actually costing the operator if it's done correctly. So for those operation reports, it would be the cost of having somebody on staff to maintain the system and document and submit the operation reports, which should be happening regardless of whether they're doing reports or not. Somebody should be having eyes on that system every single day.
Question, this is, and I realize it's for discussion, this is what you propose.
This is what I'm proposing. You guys can take this to wherever.
I'm just thinking of going back to the one we implemented 50 minutes ago. Some of them just three. This says 300. So these are just $100.
That was different than what we wanted.
So it would be for their first. So it would be for their first violation of that. It would be $100. When they've had a second violation within the year, that would be a $200. When it would be a third violation, it would be a $300 automatic fine. It would be adding. Yeah.
So it would be $600 if they missed three.
And the question is, I'm just looking at this, what is it now?
Right now, it's $100 per fine.
So I'm just saying, it would, another column would have been nice just to say, this is what it is. But you're saying it's $100.
It's $100 for everything.
Okay, that's fine, then we know what it is. Okay.
Yeah.
So first violation is 100, second violation is 100.
Yeah.
Okay, fine.
Yeah.
Okay.
Yeah.
For all of these, whether it's for operational records, for bacteria samples, for
They're always
required
just $100.
samples, it's all $100.
Okay.
And plus that surcharge piece, if we want to do it. Understanding where we're at.
For these operational reports, is there any opportunity that it can be automatized? I mean, I'm thinking of hospitals where you had to do these temperature reports on the refrigerator, and you write it down right now. Now it's all automated.
They can, it's very, the equipment to do that is
Yeah.
very expensive. Most of our little mobile home park buildings aren't going to do that. The instrument that's required to do that is about a $20,000 purchase.
Yeah.
So
The other thing is, can they do it, can they report to electronic?
Oh, absolutely.
They,
Okay.
yeah.
We take fax, we take email, we take drop it in the box downstairs, we take snail
If,
mail.
if they take a decent picture of it with their cell phone and text it to us, we'll take it. Yeah. Yeah.
I really appreciate you laying down all the possible scenarios. So it's
I tried.
think of leaving it.
Yeah.
Well, and just for your education, where we have these other missed samples required, I actually did reach out to labs in the area and try to get kind of an average cost of doing those samples and propose something that is going to be more than the cost of doing that sample. Because what is my incentive to do a $1,200 sample if I'm going to get fined $500?
Yeah, and those sampling costs for the private labs certainly are going to change year to year. So that's why the costs that I've listed in that cost to operator column versus what I think we could at least be moving forward on charging for these fines is, a bump up. So that it leaves us that little. Mm-hmm. Mm-hmm. Exactly, that's the idea, yeah. So then there's I was gonna say at the bottom of that first page, so these are all the different types of additional sampling that can happen. So obviously you can see some of these get pretty pricey, but these samples are only required one time in a 3-year period. So they've got 3 years to get these things in.
And there is a note there right above the block that says other required samples in bold, a failure to report samples. So
Oh, I moved that, Nat. Sorry, you don't have the most current one.
That's right. So there is an onus on them not to just do the sampling, but to report the sampling. And our thought is if we have to chase them by sending them a hearing notice to get them to report the sample, if I send you a hearing notice and you say, oh wait, I have that sample, here's the result, we're still going to charge you something.
So that's on the top of the second page. I just labeled it for organizing the spreadsheet.
Right, exactly.
Right.
And that's new.
We do find them for not, at this point, we find them $100 for not reporting on time.
Around the table, should we? Oh, go ahead.
I was just gonna say, and then that last sort of section would be a circumstance like we talked about earlier, where where we get out there and they don't have chlorine in the sample. We see this. So the circumstances where we would be going out would be for the facility that was on your agreements to settle. They actually pay us to collect their samples, their required bacteria samples. So we're out there on the regular. And that gives us an opportunity to see what's happening. But also, anytime we do a restaurant inspection, we check water for chlorine residuals if they have a private water, a public water supply in house, or potentially, campgrounds, mobile home parks, that sort of thing. When we do our routine inspections of the facility in general, we would be checking for chlorine residuals. Some of the facilities are going to have treatment with chlorine. Some of the facilities are going to have treatment with UV lights. So obviously, if they have a UV light system, we would not be looking for chlorine. We wouldn't want to see chlorine in the UV light system. But so that would be specific to the systems that have decided to permanently disinfect with chlorine. And then the one on the bottom there is sort of an open-ended question about sort of these examples of just they're continuing to do the wrong things over and over again, and they're just significantly not complying with the requirements. Is there something aside from the chart that we've sort of laid out that maybe we want to have just this is your 5th violation of any kind within this year time frame? So that would be something that if you guys, felt any sort of way about, we would be open to hearing thoughts.
I think you gotta have that. Because no matter what you put up, someone will do something. You can think about it, goes through life. Lose all up. That's so you gotta have it.
Yeah.
And that's gotta be depends on what it is.
Could we bring it in for a hearing if they have 5 violations or maybe like make sure coming in for a hearing?
Absolutely.
I mean, that's what we tried to do with the first fact and findings case that you guys voted on tonight, but because they have been a significant non-complier, we tried to say, you have to come in hearing, and they just didn't show for the hearing.
Well, the details are right. I'm sure you guys have talked. And we need to think about within New York State regulations and stuff, how far the board can go. And as we're thinking along those lines, what is the other recommendation?
And cover that date, you would put a question from you too. Find the violation of property, you would find the violation of county taxes.
Yeah.
You would, how do we get? Maybe that's
Yeah, we're still working on getting some of those questions answered.
right. Yeah.
Because we have that instance right now. The person that came to you in June or July, whenever that meeting was, that you issued the Board of Health order, they were due to have paid it by November 10th, and nothing has been paid. They're still not taking care of the chlorine in their system the way that they should be.
And unfortunately, they're a facility that we don't issue a permit for them to operate. So we're, yeah.
And even if you could, I mean, what do we do in the instance where it's a mobile home park? Are we gonna pull the permit and kick all the people out of there? That's not really required.
Like this one we just said. If they don't, I can legal things. You gotta do something, or just make ourselves.
Or at least a collection fee or something.
Right, yes, so part of that, Natalie and Jessica spoke to earlier too, are some of these crossover granted authorities of the state. It's really the power that is so vested in your board really comes through public health law, state law, that gives you authority. And we have state ag and markets oversight and this kind of umbrella relationship. So it is a legal quandary in a number of ways because, to navigate the legalities of all of these different systems and different capabilities. It takes quite a bit. So that's where within our local sanitary code, it's wonderful when we do have some maneuverability and ability to put in our own fines and structures because we're setting up on there so we can maneuver those legalities in a much more efficient way.
It's under the auspices, every county's got the same issue. I would think this isn't.
So
breaking new
what's,
ground.
well, what's interesting is that not every county is in the same state of things, the state of, because not every county is a full service county. So not every county has an environmental health department.
Those
that
who
does
are.
this work.
Whatever, it's 20. So,
Mhm.
I mean, I would think this would not be materially checked.
It is somewhat unique to us in that we have the second highest number of public water supplies in the state. Because we are such a rural county. We have the second highest number.
That's not real.
Yeah.
So it's the difference between public water supplies and municipal
Right.
water supply.
Yeah.
Yeah. I
Yeah,
know,
so
it's the
some of these
minutia.
issues are kind of.
Well, and
unique
this is
to us.
exactly what makes this so difficult to navigate.
And that's why I brought Natalie.
Natalie, is that an absolute problem?
That's absolute number. That's absolute number.
I think Dr. Conley brought up the point, are we going to consider this now?
Thank you, Bob. I was going to say that.
Bring us back to where
Yes.
we were.
Thank you. I think a couple of things we need to hear, or more than a couple of things from legal. Members will have a chance to kind of digest it a little bit better and have their own questions. So I propose that we pick this up again.
And I am happy if folks are looking through this and you can't sleep at night thinking about these things, and you've got questions that you'd like input or further clarification, please shoot me an email. Natalie and I will get together. We'll give you more examples of, situations or whatnot that we've seen, or to flush that out a little bit. So then the other thing that I would like the board to vote on tonight, if they have an appetite to do so. The last page of this little packet that I gave you addresses private sewage, so your septic systems, your on-site wastewater treatment systems. In our sanitary code, Article 4, Section 3, Item D, specifically references that each household sewage treatment system shall serve a single dwelling on an individual lot. If you remember a few months ago, we had a letter from a resident who requested a variance for this item. What I'm asking the board if they would be at all interested in essentially giving that power to the health director, the public health director, to make those variance determinations rather than bringing it to the board, provided that the parcel is large enough and can accommodate multiple on-site wastewater treatment systems that are able to satisfy all of the New York State Department of Health and DEC separation distances. We have these things pop up, and I always appreciate the input from the Board of Health, but in my experience, you folks seem to trust that we have a thorough understanding of things.
This is a little different than the other ones we have, where if you want to hook up a second system or second house or trailer to the existing
Correct.
system, we get those all the time. This is different. This is putting a second system.
Yeah, this is like a 30-acre parcel that has a house here with a system, and then they want to, hook up another something with another system, and they've got plenty of acres to do it.
We've had at least 2 or 3 of these in the last couple of years. And it prolongs these transactions for the folks. I think it probably makes sense as long as there's some real objective criteria.
Mm-hmm.
To me, it just makes sense. 40 acres, somebody wants to go farm.
And it's big enough to meet all the other requirements.
Right.
Otherwise,
Mm-hmm.
I make a motion to endorse your recommendation. necessity of it.
Thank you, folks.
All in favor?
Aye.
So move it. Any opposed? Sorry. I moved it before.
Oh no, great, right in time for my I
That's
fall asleep
There
now.
you go, sanitary code. I'm already in that state.
Thank you guys for listening to me for so long.
Can I grab one of the old business? The dental here, we talked a lot about. And Western Health Foundation, kind of some about that, maybe you could update me, because I don't know if there's
Yeah.
discussion further there. And maybe that was gonna be on the.
It's on my report. We will
Then we'll.
review. Any other old business before we move on? So hopefully I won't put you to sleep with this. I'll try to keep this exciting and abbreviated and short for all of us. We're at the last stretch of the meeting. So I did want to just take a moment just to highlight again Nick and Rita who are here with us today. So these are two of our 4 fellows that we were very grateful to have. So Wendy Douglas, who's also here with us, Wendy has been a mainstay in the department, and she brings a major background of expertise to our department. She really oversees the facilitates the fellows program, although the fellows are dispersed in different divisions within the department. These two happen to be local, both North and South County represented with them, which we love. And really the whole premise of the fellowship program is the federal government through the CDC really recognized, specifically during COVID, that we are grossly under capacity in relation with really truly well educated people, and not just having kind of grown up in systems, but really having experience in everything from policy to environmental and engineering and nursing and the whole 9 yards, and really coming up through the ranks with the public health education and these things. So they have invested a number of dollars into each of the states through the CDC, and the states in New York State, they really flowed that down to us. We were able to negotiate to get a few more fellows, which I was really excited about. And they are here doing really wonderful work. So I would encourage you, if you have time, reach out to them today, ask them about the work that they're doing. Not only are they doing great work for us, but we're hoping that this is a really great experience for them too, because we want to really retain these young people, these professionals. They bring wonderful skills to our department and to our county. So I'm in particular very excited about the fellowship program. It's really wonderful to so take advantage of having them here tonight and welcome them and pick their brain a bit about what they're doing. Not to put you on the spot. Get ready, start jotting down some notes over there. The other thing I wanted to highlight quickly, I didn't get it on my report, but for those of you who may not be aware, I know Dr. Hitter and Matt would have been very familiar with this because they had joined us as a follow-up to some of the notes that I had last time we met around the homeless coalition and the unhoused situation that we're really found ourselves in nationally, but within Chicago County as well. And it was really timely that the homeless coalition had been working with and documenting themselves to the point of in their strategic planning to do kind of these community facilitated discussions with stakeholders, both people with lived experience and a really nice cross-section and sampling of organizations and agencies throughout the county. So the health department was represented in those conversations as well as some of the other agencies. I have been a part of a number of these strategic plans. I'm sure many of you have as well. I was particularly impressed having come out of it on the other end. Very well facilitated. The sense and the tone of the conversations, I think, was very encouraging and much needed for a number of the agencies, specifically the community-based organizations and units, to have Both local government represented there with them and kind of shoulder to shoulder having these conversations together. I think it was a very unifying experience in that sense. And there's some really tangible after action reporting outcomes and sort of action items that are coming from that. So we can certainly forward along the next steps action plan that's been put together from those facilitated discussions. There's also an asset map report that was put together and I think really highlights nicely the perception of services in the community as a provider as opposed to people in the community and people living through the experience of pharmacies, and how there are a few very clear similarities that were both identified with both groups, and yet some vastly different assets mapped in those groups. So what an asset mapping exercise is, if you're not familiar, you sit down and you take a topic area and you say, what services are out there that you know? And let's list and let's brainstorm those and you get those lists down. So the people with lived experience, there are a number of organizations or agencies that either they do not want to utilize or are not aware that we're pending on those. So it just helps us as program implementers and developers, policymakers to better understand where maybe some of that work is needed and some of these gaps can be filled and bridged. And it also just helps us, remember, as I talk about a lot of times, we have to remember that even though we come, those of us in this department with the heart of a public health practitioner, we are embedded in government. And so we have to be aware that, people in the community see us as government and be very aware of that as we approach our community. And we work really well with our community-based organizations to help us bridge those gaps that we can consistently have. People don't always love to see, I'm sure some of you know, don't always love to see, Marty, the government people roll up, right? You know how that goes. Oh great, you're there again. But I just see some really positive and encouraging steps taken in the community. So I know a lot of times I'm here to report on the things that need to happen or aren't happening well or we need to do better on. So I thought I would share that very positive.
The challenge coalition, amongst the other things, the opioid addiction, some of the other challenges, exposure is neutral for unborn babies, is homelessness and housing crisis right up there. We saw where your department came in and jumped right in what city went through this past summer. So I think I was having a discussion with some of the other folks in the area who were part of that coalition. This could be one of those coalitions where community down to resources can make the time, and it's a big task. It's encouraging to see that.
In addition, we'll just run through what's actually on the report now here. So there was recently a regional-led conference. Oh, I wrote that multiple times there. So I was very also encouraged there to see we had a number of county partners attend, some of our legislators, and a handful of our staff were able to attend there as well. And I couldn't go without also noting that Southern Tier Pediatrics, specifically the Randolph office, was awarded the Provider in Excellence in Lead Testing. And also, of course, our Jamestown Pediatrics office was as well. So that was something really positive to highlight from that experience. And Chautauqua Opportunities was also awarded for their outstanding work in lead placement. So it was a great day and a culmination of work regionally that's taking place. I think it was really great for some of the leaders to see, where Shagnon was able to come, Susan Parker and Tom Wilson. So Tom was in his area, specifically in the city of Jamestown. It was a really wonderful opportunity to be with them on their day. Also around lead, because of course was it October, right? That was the last month here. In October is Lead Prevention Month. And there's a Lead Prevention Week in there. And during that time, the department with a consultant developed an initiative called Take Steps for Lead-Free Kids. I really love this initiative because there were over like 100,000 steps taken that day with all of the different volunteers that came out. And they went on foot within targeted neighborhoods that we know that in homeless is an issue, primarily in Jamestown, but there were other neighborhoods throughout the county that were canvassed, and over 1,200 door hangers were taken out, and also backpacks were provided for children for the different amenities and outreach.
Tracy, can I make a story about
Yeah.
when I first moved here? In '83, I think, or '82, there was an article that 4% of kids were eating teenage rates were great every annually, and we were getting led to 75. And the only agency that was like testing was Nick at the time. And this is a long way where we're now concerned to find a 6 or an 8 or a 10. I mean, I know we moved to 8. I mean, it's amazing, but I can remember seeing numbers 50, 60. And, oh God, it's awful. And to move this much,
I don't remember when last time I sent anyone over to Buffalo
for
K-Nation.
K-Nation, but it was very
It's
common
long.
to be K-Nation kids, yeah. So we've done a
Tremendous
darn
job.
good job.
Yeah, and it is wonderful, and I think you're right. We're now at the point where, I mean, we're even integrating in school programs and kindergarten readiness and preschool readiness programs and doing screening. I mean, the relationships are growing, which is a wonderful thing. And then, no small task for Jessica and Anna, who really does kind of the program management of this, to then balance that. There's always the balance of once you really start that engine of awareness happening and more players, we also have to be prepared to then mitigate and actually do the work that comes along with that. So we're right at that tipping point. The web rental registry, which we talked about before, is moving full steam ahead into 2025. And I should have noted there as well too. We will have a presence of specifically the web program team, but for the health department also in the South County, co-located most likely right within the city of Jamestown. So that's going to be wonderful as well for families and the landlords alike to be able to access us right there within the city of Jamestown. So we're excited about that. Some other great news, we were able to forge a new partnership, and I knew is kind of in quotes there because we're working with TCC, so that's not new. We work really closely with TCC all the time. But we were able to kind of bridge some of the services that they had brought on recently under their dental health program to help our correctional health mental needs as well. So Dr. Fall is really spearheading all of that work and kind of integrating that into a system, which will be a significant cost savings to the county, and just better care, more dignified care for the incarcerated individuals and just staffing in general, even for the officers, such as school and things like that. Did you want to say anything particular about that?
No, I think it might be acceptable. This is obviously not having and it places a huge strain on the sheriff's office and the we're transporting individuals to Virginia, to Buffalo, so you can imagine we can only transport a few individuals at a time. There's a huge demand. 200 plus census of Bureau. Mental health is quite poor amongst this population. And we are mandated by the state to offer this service, whether it's So having the dentist come in, our situation, to just we traditionally have had a agency dentist that just the so yeah, and I you know, we see people.
Well, I get to do that was the easy part. He has to fill it all all the work out and do it. Very kind. So yeah, as Mike and I were kind of working on that, it's transitions nicely into pediatric dental update. So Mr. Ketchum was very kind to help make the connection with Western and Central New York Health Foundation. And I was able to meet with Nora, the president, and Ken, and we did programs just for an initial meeting to even just get a sense of what their strategic funding plan is looking like for 25 and beyond. And, you know, with any of these sort of contingency plans that we've kind of thrown out and discussed as we've brainstormed as a group, does any of this, you know, kind of fit with what they would be interested in funding before we get, you know, going too deep with plans and ideas. And it was a really lovely discussion. They are very enthusiastic about supporting in this area. And basically now what the next steps will be is I would propose either a few representatives from the Board of Health or the, you know, so we chose to form a committee around this idea. Really what we would need to do next is develop a sort of an abbreviated business plan pitch as to what we think a couple of these contingency plans might look like should we be pediatric dental services no longer be available after this year and beyond. What those plans might look like, and draft that together basically in an abbreviated proposal and take that back to the health foundation. If that's something that you could also use in of course too to kind of grab in some other funders. So I've been talking with Joy Irving. She said that she would be in chats with also the Northern foundations. And then also with the other regional public health directors who are interested in making this more of a regional approach, at which point, you know, I reached out and we had some contacts scheduled with our APEC, so the American Education, Tech Coalition, or Competitions Coalition, also our Health Community Alliance, TCC is another one because they obviously have some skin in this game as well. So the one thing that Nora and Kent did bring up too is that they have been having similar discussions and starting something, you know, along these lines in the region, specifically around geriatric dental care. So they had asked if there was any interest there on our behalf to help, you know, them kind of get that up and going. And I said, well, it's wonderful because we work very closely with our office services and we have some connections there. And really, this type of model, I mean, it's more so based on the professional staff that we have coming through to serve, what if they have a certain specialty. But from an administrative standpoint, you build the model and it can serve, you know, it's more so based on the landscape that we're in, you know, a more rural landscape, a more suburban landscape as versus a more urban type model. That's more so where the administrative differences would come in. The population you serve, this could kind of be retrofitted in a number of ways. So there's some, you know, nice vision and goals, you know, behind pediatric medical with this type of program. So I would be interested to hear your thoughts and questions or concerns there. And if anybody's interested in helping kind of develop this plan moving forward, and your person helping me naturally be a fit. That will be sure to, you know, time to get together and hash out some of these contingency plans. And then as we meet with other collaborators, have them.
There's another reason I thought that most board members are on that foundation. Have a lot of many things that they and only use for us one person, only use for us. So pretty bad thing. So decent proposal, and that's always fun. Someday I have to be it didn't sound to be a hard one. I'm glad that we were about to first do. So, long.
Yes.
So, so the funding comes.
Well,
Foundation fund.
so we really would not look at this as being something that we would fund and that we would really manage. That's more so again kind of bringing in those collaborative partners. So something like TCC, this could fit really well under their guys. It could fit because they have the opportunity to do much more comprehensive billing themselves around this too. So they already have Medicaid billing processes in place and things that we didn't have. We more so do yes. So that's kind of that next step is convening who we think those collaborators would be, or at least convening groups that can help us better define who the best collaborators would be. We'd be more so the convener and facilitator, stay in the mix to provide great data and help with the grant application and a major support. They want to see that their health department is part of the support structure, but we certainly would not do it. So the committee that I'm talking about for this group would more so be just to help convene those groups and facilitate some of those discussions and some of that planning from just the expertise that you all bring to the table too. You all are, a wealth of stakeholders here at the table who understand the population, maybe what some of the needs are. So we would want your voices in the planning mix to help drive some of the vision of what this could be. But that's kind of the nice part too, is that when you get to drive the vision and say something else has to then actually drive the process. Any other questions? That wasn't a stupid question. Okay, so I will reach out, or if you have interest in being a part of this discussion, please reach out. This should say under sanitary code, it should say fine schedule, not fee schedule. But Jessica already and Natalie already ran us through that. And okay, you can tell that I did this at the last minute. We're gonna have to give you a new version. So I started to write about the update on the Homeless Coalition, but really there is our staffing updates. So just wanted to keep you kind of privy to that that's going on. So in these next couple of months, what we'll really be working on is filling 2 of the vacancies in our central kind of admin division, and those positions will help us more so on the front of our contracts, fiscal liaison, HR liaison. There's a lot that we do as a department that just deals in regulatory compliance. You would be able to speak to that very well. Our contracts, a number of different funding sources that we work with through the state. The state in and of itself has a number of different funding sources for us. They like to give us some things as pseudo grants, others as reimbursements, some as upfront funding. So there's just a lot in regards to managing that well and within the regulatory framework that we come to do a health law. So we are eagerly waiting those vacancies to be filled to really tighten that up. That will help inform, those positions will really help inform what I'll be looking to do in 2025 in a lot of the work that Dr. Falk and I do together in putting together is building out those additional revenue streams that we don't have right now. We rely really primarily on the public health side of things. You know, this isn't necessarily the same for the coroner's division and correctional health, but we rely primarily on state funding right now for the work that we do. There's other great work that we could be doing in the community. There are some gaps that we could fill in the services that we provide and do things a little more comprehensively. Instead of some of the band-aid fixes, we can do some foundational fixes of some of these problems. But we need some additional funding to do that. And so as not to put the burden on taxpayers and increasing local share, we're going to really put a comprehensive funding plan together that will allow us to, leverage some of the foundation money, and other things, that we could be doing that we would have done. So that grant coordinator position is also the position that would really help integrate those grants into the department in a way that doesn't require us to add staff necessarily, but allows us to delegate those funds and those monies either to services and programs that we already have, then fill those gaps, or to community partners. And then the other staff role that we'll be looking to fill in 2025 is that special projects coordinator, and this is specifically around stuff that Con was alluding to earlier, substance use prevention, and that runs the lifespan and the gamut of North County, South County, rural, urban, whether it's the cities or the towns. There's a lot of substance use prevention work that we need doing, and doubling down on some of the work that's already doing. So that special projects coordinator will really be able to kind of run with that and take that, a lot of what's we're kind of pushing into our other departments and our other program areas. They'll be able to kind of coalesce that into one specific focus. And then just the funding updates, and this piggybacks right on that topic there. Really, the opioid settlement funds are kind of the big one that we're working on right now. Building out and submitting project proposals for submission to the mental hygiene department, and specifically mental hygiene because for the county, they are the local government unit that accepts that funding from the state level. So we technically have to position them for a number of these projects. Really, the focus that we're taking, if you remember, that opioid prevention and substance use prevention strategic plan that we put together. I think we provided copies of it 2 months ago. It's all based on all of that informed data and evidence base. So the programs and the project areas that we're applying for this funding, all centered on those 7 priority areas. And really, it's more so actually working with the community-based organizations for projects that we are implementing or will implement. So again, it wouldn't necessarily be on-site. So Steve Kilburn, though, we will invite him to the next breakout meeting to give you an update on what some of those projects are and what some of them will be.
Now you see sort of 2 different pots of money. It's a little bit complex, but in total, close to $50 million. Next year, this first year, still close to $2 million. Maybe longer. We're still active lawsuits. We think some of it. On top of that, we can hear about our deals.
So I remember correctly last time, called it
use some subway. We have used quite a bit of to the tune of about 500,000 service per year. Yeah,
You're right.
so long-acting buprenorphine, using that for medication-assisted treatment program within the jail. It's about $1,300 per injection. We have had a lot of success with it. We are hoping for some significant positive outcomes. Reduce recidivism, more compliance with treatment, reduce. Fortunately, that data is not captured because we were trying. So on the back end, post release, we are looking at trying to implement peers, folks that could track that. But from an operational standpoint, we have at any given time 30 to 35 individuals on medication-assisted treatment to avoid diversion of medications. We've been trying to avoid give medications to 5 people at a time. So it's a lot of transports done, a lot of various medications, not just the so operationally, from a security standpoint, we've had a lot of success with that. There's a lot of data to support reduced healthcare costs, reduced recidivism, reduced crime, reduce of so we've had some success with it, but the downside is that it's expensive. There is a medication assisted treatment program. Yeah, but we have a plan over the next couple of years to phase out the opioid settlement primary sort of allocation for the cost of the
You mentioned that you had trouble because of the discharge following, but you do have some data with respect to the specific treatment. So how successful are you with respect to seeing how often?
I have found that it's also very difficult. It's difficult to
Okay, you have records of effective giving this information to a number of people. You also have records of everything.
Yeah, I think the challenge is not to do all of this. And I think those are the gaps that we want to. We want to be able to deploy some of the that. It's just right now it's it's a matter of it's such a revolving door. Most people are there for these weeks, not years. You don't have a lot of time to do it. And trying to keep your head up and trying to put things together. Our nurses probably have 30s, 40s, 50s patients coming down to busy. Trying to find anybody to keep on top of just one data that's challenging. But those are gaps that we're trying to fill. There's room to try to do. So we now have a hub across the street from you, which is a program that we should have. They have another little network peers, peer advocates. It's open most every day, at least 6 days a week. they have full access to employee partners to certain benefits. New York Matters is very robust. Where if somebody is released something that is able to release a business card, call the comments and grid script. That hub has been busier and busier as the weeks and months have gone by, and it is an important access point into the system. And folks like that. So I'm sure if we
And just to add, and I don't have comments on this one too, but on that subject, one of the things that is the priority area for that special project coordinator would be to be very much integrated and involved with the hub work that's being done there to kind of help be a part of those navigation services that Dr. Paul was talking about. And Steve Wilburn, who's sort of filling that role for the health department now as a contracted employee. One of the things he's talked about is, or that he has been doing, is been working with the community providers on that sort of continuing where one of the issues that we do see in the county is goes back to staffing issues too. State Point, just the wait time to be able to get in there because of staffing issues and things there. So, who really does that work? And sure, within these agencies, nobody really does that work. Nobody's really having that conversation yet. The hub has helped. So there's special projects coordinators and there's positions that can come in and say, hey, here's the disconnect between these two dots and what can we do to start those conversations from a more macro level that supports some of the initiatives.
I heard that really interesting TED talk. Like Bromley from the East Coast grew up in the Mountain Valley, and he got involved in prison I think it's in Phoenix, and it's prison, it's women's prison, and they've made them into a call center, and these women are trained to, and you can employ them to make calls for you, and it's totally amazing. Yeah, they teach you how to talk, how to get on it, and it's fascinating. And some of them graduate, come out and get jobs. One of them is his chief assistant, and it's fascinating. Given the right environment or whatever else, second chance for some of these people, it would be marvelous things. Your population is probably that would be possible. But this is fascinating story. There's a guy in wealthy family who just didn't know what he wanted to do and came up with this idea. My daughter visited yesterday. She went to why these people doing something. And you would never know you're talking to a prison. I mean, this is an articulate individual you're talking to. It's trained with, amazing.
Not a Brahmin by the name of Andrew Weir. He's in Arizona as well.
I know his true food stories. Restaurants are the best. Restaurants.
Anything else tonight? Any questions? Yes.
The most exciting thing about what was selling is the fact that it was being used over prices. Unlike 25 years ago, that was something that came to town for $25 million. That was never $100,000 was marked towards youth prevention and never allowed to be spent out of all those millions. So it was securitized, paid down our debt, and then racked the debt back up. So we've come a long way in 25 years to be able to use settlement money for the actual purpose that it's intended.
And there are some of the other funds that the bank is moving to that are more that have come and set aside money. We're hoping to put together a pretty robust plan of some other ideas and, you know, push that to the legislature too in terms of some ways that that could use some attention.
I just wanted to bring up that we did have in the dental end, Monroe Community College in Manchester agreed to be partnering with them about 2 decades ago, and they're opening a dental hygiene program. Yes, and they've been working on this for about 5 years. They're trying to get through JCC, and Monroe Community College already has this partnership with Jefferson County. So they took the model and we received all the funding, so it's going to start install. No, I think it's all run through Monroe Community College, so they can take prerequisites through JCC, they offer them, but then all the didactic courses will be remote. And then TCC is actually going to be, I think, renting the clinic space to MCC. They've secured professors and the dentists. We're trying to figure out which folks to be located to help get the hours to do that. It's just awesome. They'll have 5 seats per cohort for dental hygienists. They're trying to keep those spots for people that are local to try to hopefully then go their hygiene. 2 years. Yeah, but it's about, you don't have the prerequisites, it's about a year. And you need to take a certain science. If you're a savvy, I think you should probably get those courses in the senior year. And so go right into it. So
Maybe eventually connecting with schools and offering this MCC can do
exactly,
that.
that's what it is. It's the guidance counselors that want to start pushing that.
Well, we can highlight that in our newsletter to superintendents and school nurses.
That's good news.
All right, my friends, lovely evening. And if there's no other business, I'll take a motion to adjourn. So, any second? Second by Molly.
I don't think we need a second.
You know, but it's still nice, yeah.
Getting up, Bob.